somewhat inspired to become a physician by an experience that I really had when I got to college. So I actually ran track at Duke University, and we had a legendary team doctor there. His name was Frank Bassett. He really took an active interest in the athletes, and I actually had some injuries where he was my team doctor and kind of got me healthy, got me back to performing and what I needed to do. And at some point I realized, well, I'm not going to be a professional athlete, but it would be pretty cool to be on the other side of things and take care of athletes and people and getting them back doing the things that they love. And so I think that was kind of my aha moment where I was like, I could really see myself doing this one day. And Dr. Bassett was nice enough to take me under his wing, give me shadowing opportunities, kind of mentor me throughout the process, and I'll be forever indebted to him for that. Like most doctors and surgeons, it was long, but started at Duke running track. Kind of came back to Duke later on for my actual orthopedic surgery residency training. So I spent another 5 years back at Duke. And then I actually ended up going up to New York City to an institution called the Hospital for Special Surgery, which is actually the #1 ranked orthopedic hospital in the world. I was basically assigned to start coverage with the New York Mets while I was up there. So that kind of really is when I felt like I came full circle, becoming a team doctor for a professional sports team. I'm thrilled that I was able to continue that relationship even when I moved down here to Atlanta, where I still work with the New York Mets and take care of them when they're in town playing the local Atlanta Braves. A typical day for me, especially on a surgery day, I'll probably do somewhere 6 to 7 surgeries in a given day. My focus is sports medicine, so I'll do a lot of rotator cuff, ACL, meniscus surgeries, primarily arthroscopic. However, I feel like I got a lot of good training in just general orthopedics as well, so I actually enjoy doing a variety, and I'll still do plenty of fracture care, total joint replacement, carpal tunnel surgery, and I really enjoy the variety that brings on a day-to-day basis. And then of course in clinic, we're following those patients up, making sure they're coming along with their appropriate rehab and recovery. I really feel like I'm a people person, and that was one thing I knew since I was younger. I always enjoyed being around people, and to me, I think that truly is the most gratifying thing when you can help someone fix whatever their problem is and get them back healthy and active and essentially give them their livelihood back. There's nothing that's more rewarding out there. One of the things I really enjoy outside of work is still kind of doing a myriad of sports coverage opportunities, which Piedmont Orthopedics, Ortho Atlanta really allows us to do. I think it starts at the grassroots level with the high schools and doing Friday Night Lights, which is one of my favorite things to do. But I'm also fortunate now to be the co-medical director of the Atlanta Open, which is the men's professional tennis ATP tour, as a lead up to the US Open that we do every summer here. And I'm also one of the main physicians for both the AFLAC kickoff game as well as the Chick-fil-A Peach Bowl, and then still also have my relationship and coverage with the New York Mets when they're in town playing the Atlanta Braves. I'd say one of the most important things that I tell patients from my standpoint, especially with recovery and surgery, is just how important it is to kind of have the end goal in mind. It can be difficult sometimes, say you have an ACL reconstruction that takes 8 to 12 months to fully recover. It can be hard, especially that first month or two where you're not getting to do a whole lot, you're pretty restricted. It can be mentally deflating. So I try to keep them optimistic, have them look at the big picture, make sure they understand the importance of kind of reaching their milestones on physical therapy along the way, so that eventually, of course, we will get them back to that outcome of 100%, back to doing everything they want to do. I feel fortunate to have been here with Piedmont Orthopedics, Ortho Atlanta for 9 years, and I think that speaks a lot to the family and the community that we really, I feel, build amongst the providers in our group. It's a kind of a combination of finding the right people and then staying active in the community with the different kind of involvement in sports, etc., that I think represents us well. The biggest thing I want my patients to know is how much I care, how much I strive to do everything I can to get them back healthy, active, and doing the things that they love to do. I'm not one of those people that shuts off when I leave at 5 or 6 p.m. and I clock out. My mind is constantly going on what I saw that day, what can I do better for my patients going forward. So it's 24/7 the care that patients are going to get from me until we finally get them back to where they want to be.